Let's talk a little bit about peripheral nervous system, and in particular, we're going to look at the brachial plexus. So, just to orient you, there's 31 pair of spinal nerves, both motor and sensory, which exit the intervertebral foramen, so the hole between two vertebrae. And then we have things called the cervical plexus, the brachial plexus, which we're going to focus on, thoracic nerves, and then the lumbosacral plexus. And just in an image, this is what it'll look like, right? So we have our spinal cord going down, and then nerves, plexus of nerves leaving the cervical region. Brachial plexus goes into our upper arm. Lumbar plexus and sacral plexus go and innervate our lower limbs. So, what is a nerve plexus? Plexus means braid. So multiple spinal nerves exit the spinal column, and they innervate an area of the skin or a muscle. Um, and if you have multiple spinal nerves innervating an area, that results in a very redundant system, meaning an injury will not result in complete motor or sensory deficit. So you can imagine all these nerves exiting the intervertebral foramen, and they're braided together from different levels to innervate different muscles or skin areas. And so it just keeps us safe. So the cervical plexus is the ventral rami of the spinal nerves C1 to C5. The major nerve coming out of this cervical plexus is the phrenic nerve, which innervates the diaphragm. And as you could imagine, like having the diaphragm innervation coming from multiple spinal levels, if in case we got injured, we could still breathe. The brachial plexus, which is the focus of what we're looking at as we move on to the upper limb, it comes from the ventral rami of spinal nerves C5 to T1. It innervates the muscles of the pectoral girdle and the upper limb, except the trapezius. It supplies all cutaneous innervation except in the axillar region. And it's pretty complex, but if you spend some time and look at the plexus and how it kind of exit the spinal cord and goes off to our upper limb, it has some very interesting ways it's formed and separated. You can think about it as like the highway system or the freeway system, right? Like freeways merge and there's exits and then they merge again. And it can get complicated, but we all learn it to drive. So we have trunks is the first section, and we have a superior trunk, a middle trunk, and an inferior trunk. After merging from the intervertebral foramina, the roots unite to form these three trunks. C5, C6 is the superior trunk, C7 is the middle trunk, C8, T1 is the inferior trunk. Then it becomes division. So each trunk splits into an anterior and posterior division. Anterior divisions usually supply the flexor muscles of the upper limb. Posterior divisions usually supply the extensor muscles. So that you can see the redundancy. We have for flexion muscles, we have um, uh, contributions from every trunk, thus every level. Then the plexus becomes cords. We have a lateral cord, which is formed from the anterior divisions of the superior and middle trunks. The posterior cord is formed from the three posterior divisions. And the medial cord is formed from the anterior division of the inferior trunk. And cords are named based on their position to the axillary artery. So let's look at this. Here's a very standard brachial plexus image. If you Google it, you'll see this. So here you can see C5 to T1, so everything leaving the intervertebral foramen. Then we have the trunks. So we have our superior trunk, which was C5, C6. We have our middle trunk, which is C7. And then our inferior trunk comes from C8 and T1. So we have superior, middle trunk, inferior trunk. Then we have the divisions. So all trunks go anterior and posterior. So middle trunk, anterior, posterior, and inferior trunk, anterior and posterior. Well, that would actually be anterior and posterior. All the posterior trunks become the posterior cord. Right here. This is a combination of all those trunks. And then we have the lateral cord, which is a combination, and then the medial cord here. And then these cords go on to be our nerves that innervate our upper limb. And you probably have heard of some of these nerves: the ulnar nerve, radial nerve, axillary nerve, median nerve, musculocutaneous, etc. So major nerves of the brachial plexus become the musculocutaneous nerve, which is the anterior arm innervation, and it's from the lateral cord. The median nerve innervates the anterior lateral forearm, so the radial side of your anterior forearm, and that came from the medial and lateral cords. The ulnar nerve, aka your funny bone, innervates the anterior medial forearm. So it's on your pinky side, and that comes from the medial cord. You have the radial nerve, which innervates the posterior arm and forearm, coming from the posterior cord. And then finally, the axillary nerve, which innervates your shoulder region.